Hello everybody, I'm Liburn Grabovci and today I'm going to present my work which I prepared together with my mentor, Professor Patricia Tai, and the other co-authors which I've mentioned below. The title of this presentation is Improving Quality of Life Among Cancer Patients in the Modern Era. Now, I'm the first author of this publication and I just graduated from the University of Pristina. And me, together with my colleagues, we are collaborating with Professor Patricia Tai, who also serves as our mentor. Now, we all know that cancer treatment may lead to a wide range of complications, which may be acute and chronic. Some of the acute complications, which may be due to cancer treatment, are nausea, fatigue, infections, pain, and so on. As far as long-term complications goes, they may include neuropathy, hormonal imbalances, infertility, sexual dysfunctions, emotional disturbances, and so on. Now, for this study, we included literature review. There was a literature review conducted in PubMed database, and it was aimed to identify strategies that improve quality of life and to manage post-treatment complications among cancer survivors. Now, our results showed that one of the most common complications is due to radiation, which causes radiation-induced skin toxicity. Now, studies have shown that radiation-induced skin toxicity may be lowered when used intensity-modulated radiation therapy. Intensity-modulated radiation therapy leads to the reduction of late radiation complications like breast induration, scarring, telangiectasis, and so on. As far as the complications which may be due to radiation, they may be telangiectasis, ulcerations, and they may go till the most severe form, which is fibrosis. Now, for telangiectasis, the only method with limited evidence of efficiency is pulse-dye laser therapy. For chronic ulcerations and necrosis, low-intensity laser therapy and also platelet-derived growth factor with a hydrophilic copolymer membrane have been shown to be beneficial. As far as radiation-induced fibrosis goes, there are some treatment methods which may include vitamin E, hyperbaric oxygen therapy, laser therapy, and so on. In extreme cases, there may also be surgical interventions needed. Now, some of the forms which are shown here are, as I mentioned before, vitamin E together with pentoxifylline, hyperbaric oxygen treatment, which is quite costly, surgical debridement, and also a new therapy, which is photodynamic therapy, which, if you want to go more in depth in photodynamic therapy, my mentor, Professor Patricia Tai, together with some other authors, have prepared a paper for this. Lymphedema of the face and neck is quite common in patients who have undergone head and neck surgery or treatment. Now, one of the main reasons why lymphedema is shown in these patients is because of the scar formation, which leads to lymphatic drainage problems. And so in up to 75% of patients, they may suffer from lymphedema. Now, one method which has been used to treat lymphedema of the face and neck is submental liposuction. Liposuction showed significant improvement in self-perception and self-confidence. Now, other methods which may be used, which are non-invasive, are kinesiotaping and advanced pneumatic compression devices. Here I've put a photo of patients before and after treatment with submental liposuction for lymphedema, and you can clearly see the improvement in patient post-operation. Now, another quite common complication, which is especially evident in patients who use doxorubicin, is cardiotoxicity. So, AI model was created called Cardio AI, which helps medical providers assess cardiotoxicity earlier. Now, Cardio AI is programmed with 5 modules, which are module A, B, C, D, and E. Now, module A is basically shows the patient's information like age, cancer type, treatment plan, and so on. Module B is a daily summary of new symptoms and other reports. Module C is for physiological data like heart rate, temperature, breathing, oxygen, and so on. Module D is AI-generated risk score, which helps us predict the risk for cardiotoxicity. And Module E is a conversation log, which displays the patient's spoken reports. Another quite common complication is urinary incontinence, which patients who have undergone radical prostatectomy quite commonly face. Now, a study have taken 43 men who had undergone radical prostatectomy, and they did a modified version of pelvic floor exercises. Now, in these modified exercises, they used a resistance band. And this study looked at the urinary incontinence scale, incontinence impact questionnaires, and hospital anxiety and depression scales. Now, measurements were taken 2 weeks, 1 month, 2 months, and 3 months after catheter removal, and results showed an improvement in urinary incontinence. So basically, it decreased, and quality of life improved. Anxiety and depression were decreased. The reason why this modified technique worked better than the standard pelvic floor exercises is because the resistance band helped patients feel and perform pelvic floor contractions better. Another common complication is sexual dysfunction, which women quite often face. They may face pain during sexual intercourse and other problems. Now, in Canada, there was a trial which firstly they did a 30 to 45 minute training session with oncology providers. Now, in this training session, they had a lecture which talked about sexual dysfunction, and also they introduced a new clinical tool which was Did You Card Her? Now, card meaning C for context, A for assessment, R for recommendation, and D for documents. Now, context, basically we know the basic information about this patient. A, assessment is what we may see during this examination from the patient, or recommendations which we may give to the patient to improve their quality of life, and D, documentation, so we write what happened during this examination which we did. Now, results show that medical providers had an increased comfort talking to their patients about these problems, and also role play, which was done during these trainings, highly improved their communication skill with these patients. Now, another problem is psychological disturbances, which now digital psychological interventions were tried in a group of patients who had psychological distress after cancer treatment. Now, some of the methods used were cognitive behavioral therapy, health education, and virtual reality therapy. Now, these showed improvement in psychological problems like anxiety, depression, and fatigue, where CBT and VRT showed improvement in quality of life in these patients. Also, only CBT proved effective in alleviating insomnia, and only mindfulness-based interventions significantly reduced the fear of cancer recurrences. Another problem is the loss of bone mass. Basically, most patients which are under cancer treatment, they may face osteoporosis and later on fractures due to osteoporosis. Now, some measurements which we may take to prevent osteoporosis may be non-pharmacological and pharmacological measurements. In non-pharmacological managements, which we may use amino acid, vitamin D, calcium, physical exercise, smoking cessation, lowering alcohol intake, caffeine intake, and so on. In pharmacological management, we may use biphosphonates, denosumab, bone-forming agents like teriparatide, selective estrogen receptor modulators, and calcitonin. As a conclusion, cancer treatment can lead to diverse long-term complications that affect patients' quality of life. Chronic radiation dermatitis, including fibrosis and ulcerations, remain difficult to manage, though techniques like intensity modulated radiation therapy help reduce the severity. Also, head and neck cancer patients often face problems like lymphedema, which have been shown to be treated with quite great success with submental liposuction. Also, an AI-based tool like Cardio AI may help detect cardiotoxicity earlier. Rehabilitation strategies such as resistance band exercises improve urinary incontinence in patients who have undergone prostatectomy. Also, sexual dysfunction still remains a quite common problem, but through training programs, these difficulties may be alleviated. Also, digital psychological interventions have proven effective in reducing stress, anxiety, and other psychological problems and improving quality of life. Also, bone loss due to cancer therapy, including fracture risk, require timely preventive interventions. So basically, there need to be more studies trying to improve the quality of life of this group of patients, even though in the past years significant improvement have been done. For the end, I want to thank people who made this presentation possible, them being Professor Kevin Wang, Professor Maha Subi, Professor Osama Suyed, Professor Vimal Prapajati, Omar Al-Qaiz, and my two friends, Laurent and other collaborators, which I would like to mention and thank, are Glenn Bauman, Andrea Beziak, John Ho, Rashmi Cole, Kurian Joseph, Jake Van Dyke, and also my dear professor, Patricia Tai. So this was my presentation, and if anybody wants to look this presentation up, I posted it in ResearchGate so you can read it. Thank you very much.